topic of the EHFG conference is Dancing with Elephants, New Partnership for Health, Democracy and Business. Pick one elephant of your choice and tell us one challenge and one opportunity for the health sector to dance with it.
So I was thinking maybe the issue of representation, having diversity amongst policymakers and public service leaders, for example. And I think the reason that I chose that is because often the leadership on the needs of people who experienced disadvantage during the pandemic has come from within those communities themselves and from professionals who are linked to those communities. So that just shows the importance of representation of those voices within decision making. And what people have done is challenge injustice.
In your opinion, or based on your work, what will be the 3 key recommendations for policymakers to put in place? What recommendations should they put in place in the upcoming 5 years regarding racial discrimination?
What I think might be most helpful and what is being recommended within the research is a cross-government infrastructure to focus on reducing these multiple drivers of inequity that we find within minority ethnic and religious groups. An infrastructure that would actually allow inclusion to be seen as core business rather than a marginal kind of activity. And then I think the second thing is actually looking at the accountability of publicly funded services that affect health. And a really good model that I've come across in relation to gender within the UK, again, has been a model that is used within higher education called the Athena Swan Awards. And this was linked to financial incentives. So higher education institutions could not get research funding unless they had shown that they had reached a certain level of gender inclusion. And I think the third thing, again, coming back to resource allocation, is how communities are being supported to actually come out of poverty, because there's a huge association between deprivation and the poor outcomes that we see. So supporting communities to actually break free of those kind of vicious cycles of poverty that then lead to poor life chances, poor outcomes, is another key area that I think is really needed.
How to increase the representation of overlooked communities in healthcare provision or pandemic response?
Capacity to actually take on high-level jobs. This is something that needs to be developed and supported. It's not something that can happen overnight. It's probably a longer-term aspiration. But hearing the voice of those communities and those populations within public service organisations and within policy making is really important. So in the short term, having engagement with those communities that allows those voices to be heard and actually privileges those voices, because they have been unheard for so long that actually set ways of doing things have systematically actually excluded people, and it's kind of embedded within systems that those needs are not really addressed, and maybe there may be discriminatory processes that continue to mean that they will not be addressed.